Hello, my name is Dr. Christian Mazur. I am a cosmetic dentist in Lafayette, Indiana, and it is my job to help people to believe in their smiles. I use the word help because only the person themselves can truly believe in their smile. My job is to take what we can change about their smiles in terms of their teeth, the alignment, the color, how light comes off of them, whatever it is that makes them feel confident and believe in their smile. And then from there, it completely changes how they interact with their world. There are times when people come in and they're seeking veneers. And I tell them, we don't need veneers. You have a wonderful tooth structure. You have lobing, you have translucencies, you have textures on the teeth. The proportions of your teeth are fabulous. All we need to do is put them in line, put them where they belong in the arch, expand your arch and make it look flat and big and wide, and you're going to smile just perfectly. Other times people come in and they just want Invisalign, and they may have very worn down tooth structure. And it just really is all about experience to know which way we go. Many times it's a combination. If I want to fix tooth structure that's been broken down badly, I'm going to need to put some porcelain in there with some kind of veneering. If there's really good tooth structure and all we have to do is line it up, great. We just do some Invisalign. But I will also tell you, in the end, it's how does that person feel once we've done it? I can look at it and say, this looks so awesome. Your smile is great. And they don't feel it. They are there because they know they want some porcelain, some veneering, and they want to change some things about their tooth structure. So we do it. And you know what? Boom. They just interact completely differently. So I can't make people decide. I try not to influence them on what they want or need. I'm here to lay it out. Here are our options. But in the end, they have to believe in their smile. And when they do, how they interact is so completely different. When we talk about veneers and if they look natural or real on that person, again, it really comes down to their preference. To be honest, veneers are not all created the same. Laboratories have different levels of skill, just like providers like me. So the dentist, the assistants, the people involved in that process, the lab we use is very important. Every one of these veneers is a piece of art. It's an individual piece of art, and it's also a piece of art that has to function within a range of teeth to make up the smile. There's proportion between teeth. There are lobing to the teeth, natural translucencies in the tooth, as well as texturing on the teeth. So when light hits them, it reflects differently. We don't want something that's monochromatic and just sucks up the light. So they are works of art. And when it comes to choosing shades and what we want the actual smile to look like, that is really an individual thing. I have people come in that want Hollywood white smiles and veneers, and I'll be like, ooh, you have darker hair, darker features. This is going to look really white. And you know what? We do it and it looks fantastic because they believe in it and they smile, as opposed to the person with fair complexion where I might say, let's go a little bit whiter on this. And they're, no, I think I'm good here. And they believe and they smile. So it all has to do with the artistic value that the lab puts in, and then how we evaluate the scenario in the case. But you do see some veneers that look pretty bad. And like I said, it's not the same veneer from one place to the next, nor is it the same provider or team of people that are guiding you and then placing the veneers. One of my favorite cases was a grandfather, a very successful person in the community, large family, just a bountiful life, wonderful people around him. And sometimes we don't like it, but children really kind of speak truths. And his grandchildren were taking a photo with him and mentioned his teeth looking bad and beat up and broken. And this is a big man, strong personality. And it just tore him up. I mean, it really tore him up. And he came to me and was, it gets emotional. Sometimes people cry before we do a case. Sometimes people cry after we deliver veneers and so on and so forth. In this case, he cried both times. When he told me the story about his grandchildren, taking the photos. And then once we restored his smile and we did some veneers, we did some implants, it was kind of a combination of things. And when he looked with the mirror, he just broke down and cried and sobbed. And, my assistants, of course, they cry all the time at these things. Everybody's crying. I, of course, did not, unless we're watching Old Yeller or, some movie that really gets me worked up. I try not to, but, um, it was amazing just to see that. And there's been so many after that, before that. And it's the best thing that we do. So if you're anything like me, thoughts come across your mind throughout the day. And I text people at the most random of times with a question or something that's on my mind. And the same thing applies to your smile. Something will trigger in you, gosh, I really don't like that. Or here's this person on television. I love their smile. Maybe I should do something about mine. And, the call to action there really is just pick up your cell phone. It's right in front of you. You can go to our website and we have a virtual consultation. Take a couple pictures of your teeth, send them to us. We'll answer you within a day or two. If it's a weekend, it might be the following Monday. But that first step is just reaching out to find out, and if that involves coming in for a consultation where we can take a closer look, so be it. If it never goes any further than there, at least you made that first step, which is right then and there. Because if you wait between the moment you're thinking about it and your next meal, there'll be 20 other things that come up, right? So I would say if it's on your mind and you want to know, reach out to us. We would be happy to talk and we'd be happy to consult with you to help get you started on that journey if that's where you want to go.